Welcome back to Vision Care Hearing Solution podcast series. Today we have Chatira and Yasit, and we all are audiologists. So we are going to have a casual chat today about hearing wellness.
Yes, I think it's a topic that, is not often spoken about. And we thought that that would be the ideal thing for three audiologists to discuss, basically.
Exactly. So, what is hearing wellness?
I think like when it comes to health, people would love to talk about many other health conditions. අපි ගත්තොත් heart එක ගැන, දත් ගැන, ඔය ගැන ගොඩාක් දේවල් කතා කරනවා. But I think hearing ගත්තාම කවුරුත් ඒ ගැන කතා කරන්න ඉච්චර කැමති නැහැ.
Yeah, you get your blood pressure checked, your cholesterol level checked, but hearing, who does that?
Yeah, nobody actually thinks about it that much. But the actual fact of it is like almost 1.5 billion people in the world do have some form of hearing loss. So that is a very staggering number, and not a lot of people are aware of it. So yes, it is.
And I think nowadays like we are exposed to many noises, sounds, even like in our daily life. අපි එළියට ගියත් traffic noise එක ඉස්සරට වැඩි හිතුවොත් අපි ගොඩාක් වැඩි. And අපි musics ගොඩාක් අහනවා, even younger crowd ගොඩාක් noise දේවල්
They
වලට
are
exposed
always
වෙනවා.
wearing headphones.
Headphones, gaming,
Always
headphones,
wearing
music,
headphones.
everything.
Walking
So
around.
I think we should pay more attention to hearing.
Yeah.
So, what do you think are the early signs when someone's hearing wellness is slipping? Like, කොහොමද අපි ඒක දැනගන්නේ? What are the signs that you have?
From our patients.
Yes.
So the funny part is a lot of people think that hearing, it's either all or nothing. You have a hearing loss if you don't hear anything. Like they think that you completely lose your hearing. But that's not what happens. It's ටික ටික අඩු වෙගෙන යන හින්දා ගොඩක් කටියට තේරෙන්නේ අර කියන එක අපහැදිලිතාවයක්. සමහර වෙලාවට ටීවී එකේ සද්ද චුට්ටක් වැඩි කරන්න වෙනවා. ඉතින් ඒ වගේ කම්ප්ලේන්ට්ස් තමයි අපේ patients වැඩිපුර අපිට කියන්නේ මේ
Yes.
ගෙදර කට්ටිය තමයි යෝග හැමදෙස්සෙම කියන
Oh, yeah, that
patient
is
මේ
very
ආවහම
true.
කවදාවත් patient කියන්නේ නැහැ මට ඇහෙන්නේ නැහැ කියලා.
Yeah, even from
Very
හැමදෙස්සෙම
rarely.
TV එකේ සද්ද වැඩි
Very
කරනවා
rarely
යෝග
the
තමයි
patient.
කියන්නේ.
නැත්නම් කියන්නේ එයා කතා කරන්නේ කට ඇතුලේ තියාගෙන. He's mumbling. එහෙම නැත්නම් මේ මට හොඳට ඇහෙන ප්‍රශ්නයක් නැහැ loudness එක එහෙම මේ මට හිමින් කතා කරන්න ඕනේ නැහැ ඇහෙන්න. හැබැයි සමහරක් වෙලාවට සමහර දේවල් තමයි මට මිස් වෙන්නේ. ඔය හිටපු ගමන් දෙපාරක් අහන්න වෙනවා. That's very typical, right? Yeah. And then TV එකත් ප්‍රශ්නයක් නෑ මට මේ TV එක හොඳට ඇහෙනවා. Then the other person, I don't know, the spouse or the family member would say සද්දේ වැඩි කරගන්නවා මෙයා maximum අපිට තමයි වටේ ඉන්න බැරි. Because that's the thing, like they actually when they initially develop a hearing loss they don't realize it. It's people around them that realize it, right?
Actually notice it first. And maybe even if we say it to them as a family member, as a concerned daughter or a son, it might not be taken the right way in the first place also.
Exactly.
So it's such a sensitive topic that even for us as audiologists to say that you have a hearing problem, most often I feel we have to prove it to the patient. Otherwise, it's not something that they believe from the get-go. Like a medical diagnosis, like let's say you have cholesterol. Okay, the numbers are there. You believe the doctor, but when an audiologist says it, it's not exactly. You need a little bit of more convincing.
Yes, and more time to accept it. It's always denial at first, and then චුට්ට ඒක අර රියලයිස් වෙන්න තමන්ට ඇත්තටම ඉෂුව එකක් තියෙනවා කියලා it's a journey actually.
It is. And I think there haven't been a lot of studies done in Sri Lanka regarding this, but in USA, one of the developed countries, it takes an average of 7 years for a patient to say that they have a problem and actually take the first step. So
අපේ එක්ස්පීරියන්ස් එකත් එක්ක like mild පොඩි hearing loss එකක් තියෙන කෙනෙක් කවදාවත් ඔක පිළිගන්නේ නැහැනේ. මොකද හැමදෙස්සෙම හිතන්නේ මට මොන හරි ඇහෙනවනේ. කවුරුහරි කියන දේවල් ඇහෙනවා. only thing I don't have the clarity.
Yes.
ඒකත් මොන හරි අර තොල් දිහා බලලා හරි තේරුම් ගන්නවා. I think the time consume is like කාලයක් යනවා hearing loss එක ටිකක් වැඩි වෙලා දැන් මේ මටත් ඇහෙන්නේ නැහැ කියන level එකට එන්න. අර ඒ ආවහම තමයි එන්නේ අපි ගාවට දැන් මට ඇහෙනවා මදි නේද කියලා.
Because it's slow and gradual,
Yes, exactly.
they develop compensatory strategies
Yes.
to deal with it, lip reading and everything.
The thing is, they don't know that they're lip reading. How good
Yeah,
they
they
get
get
that
that.
lip
And
reading.
that happens eventually, right?
Yeah.
Yes. So the moment that we kind of, close our lips and then talk to them, there is a drastic change on how well they are able to comprehend what other people are saying. So it is a sad situation, especially in Sri Lanka, that many people do not test their hearing unless
Yes.
they've been dragged in or
Yeah.
they've been recommended by a doctor, and it's not in a routine regular checkup,
Yeah.
Yeah.
like a medical checkup also. So that's a major issue.
They feel it only when it comes to such a stage that it impacts their conversation ability, their communications, their relationships. That's when that they take the first step. So that's a high risk, like not the initial stage. අපි හැමතිස්සෙම කියන්නේ early identification, early intervention, but this
I mean,
actually.
in every health condition, that is the most important thing to have the early identification. Like
Yes.
not only in hearing, but hearing it comes very late. I mean,
Yeah.
compared
The
to other health
damage is
conditions.
done by the time they come
They
to
come
us.
to us.
In
Yeah.
that case also මම හිතන්නේ family member තමයි අදගෙන එන්න ඕනේ.
Yeah.
මෙයාට දැන් ඇහෙනවා මදි යන් අපි ටෙස්ට් කරගන්න එක දුව පුතා. So ඒ level එක තමයි ගොඩ දෙනෙක්ගේ තියෙන්නේ.
Very true.
So very, I mean, low percentage of people තමයි තනියෙන් ඇවිල්ලා මට ඇහෙනවා මදි කියන level එකට ඇවිල්ලා check up එකකට එන්නේ.
Yeah, and this is actually not just about hearing නේද? දැන් අපි මේ කතා කරාට hearing කියලා ඒක impact එක hearing විතරක් නෙමෙයි, right?
I
Good
mean,
point.
yeah, as audiologists, I think we all talk about brain health.
Yeah.
Brain health
Brain
is
health.
something that we really emphasize on. It's not that hearing loss causes dementia, but if you have hearing loss, it has been proven by research that there is high prevalence to have dementia and Alzheimer's disease and just brain related health issues. So if you look at the broader picture of things, it plays a major role as a society as well, because it's not easy to have a family member who's dealing with Alzheimer's or dementia. It's very, very hard.
Yeah.
Yes, yes.
So that happens like social isolation. අපි hearing loss එක ගත්තාම ඉතින් යාට ඇහෙන්නේ නැත්නම් කාලයක් යද්දී he just like to don't mingle with people, conversations වලට එන්නේ නැහැ. කාලයත් එක්ක ඒක වෙනවා. So,
Hearing wellness කියවනේ quality
Yeah,
of
quality of
life,
life.
communication breakdown, isolation, and it goes on and on. It just hearing වලට විතරක් නෙමෙයි impact එක අපේ life එකේ හැම දෙයකටම job එකක් කර කර හිටපු කෙනාට how it restricts his capacity and
growth.
opportunities
Yeah.
and yes, so it has a huge impact. So brain health, දැන් aging ගැන කතා කරොත් අපි නේ especially brain health එක ගැන කතා කරොත් it's hearing නැති වෙනවත් එක්කම ඒගොල්ලන්ගේ memory එක auditory memory අපි සාමාන්‍යයෙන් දැන් මතක තියාගන්නේ අහලා. So අහපු ඇහෙන එක අඩු වුණාන් පස්සේ we put a real effort to listen. එතකොට
Yes.
අපේ mental load එක අපේ cognition like the effort that we are
Yes.
putting in
Very
and we
true.
strain
and you don't
ourselves.
understand that then end of the day you feel fatigued and tired after
tired.
listening all the conversation with noises and maybe trying to focus to the conversations even at the job. I think that makes a huge difference to your daily, I mean like quality of life.
Quality of life.
And I think there is a factor when it comes to age also. Like people who are more elderly think, okay, it is towards the end of my latter part of my life, so it really doesn't matter. It's a part of the aging
Yes.
process, so there's no point. Whereas a younger person would, take action sooner.
Sooner,
It will prompt
yes.
them to take it sooner. But it's a matter of, I guess, perspective, like the quality of life towards the end of your lifetime. I don't think it's just your choice. Like, it's the people around you as well who wants you to live better.
And I think that affects the quality of life of others as well around you.
Yeah,
Because
exactly.
There are a lot of people communicate with you. Like, let's
Impacted
say,
from this,
exactly,
yeah.
they make their lives harder to communicate with the person having a hearing loss. So if you hear better, so everyone lives happily.
Yeah. Any experiences like, once I had this lady who had a voice issue.
Okay.
එයා කතා කරද්දී ගොඩක් අන්තිමට හේතුව ඇත්තරම her husband is having a hearing loss and she's screaming like she has to speak really loud for
So
him
she
to be
developed
able.
something.
Yes, he has this voice problem. So that was the initial case. Doctor ගාවට ගිහිල්ලා තියෙන්නේ එයාගේ voice issue එකකට, but the root cause is she has to talk really loud.
So
my
that
gosh.
shows how it affects the other
The
people
other
as
people,
well.
yes.
I guess something that comes to my mind is this very young boy who woke up one day and noticed that when he put his phone to his, I think if I remember correctly, left ear, he could not hear the phone. And when he put it to the other ear, he could hear. So it was a sudden loss of hearing. And I mean, we see it more commonly these days. අපි දැන් අපි වැඩ කරනවානේ වෙනත් ස්පිරිතාලත් එක්ක, like වෙනත් රෝහල් එක්ක. ඉතින් ගොඩක් cases එනවා දැන් එකපාරට ගොඩක් young අයගේ just suddenly they lose their hearing. And it could be different reasons. And yes, and some people don't notice it for a couple of weeks and then they go to the doctor and it's too late and that condition cannot be reversed. So it's just a lack of, attention towards hearing wellness and awareness, I suppose, that has, led to this situation. But
Most of the people, they don't know what are the red flags where they have to
Yeah.
seek immediate medical attention. Like sudden hearing loss can be reversed within 48 hours if you treat.
yes.
Exactly.
But if not, you
Yeah.
can't
They don't pay
reverse.
attention, right? They don't,
Yeah.
no one pays attention. මගේ කනට මොකක් හරි වෙන්න පුළුවන්ද කියලා නිකන් කවදාවත් හිතන්නේ නැහැ.
Young
It's just
කට්ටිය
there.
ගොඩක් they don't think that මේ වයසේදී මගේ hearing වලට මුකුත් වෙයි කියන එක
Doesn't even
Yeah,
cross their
trust-
minds.
Yeah.
They think, oh, maybe it's because of wax, or maybe I had a bath, somewhere, and
Yeah.
then water has gotten in. So now, it's just a lot of excuses that we hear.
Exactly.
Yeah, so as audiologists, actually, I think it's our responsibility to raise awareness.
True, very true.
And like, what do you think about the modern lifestyles of these young kids, young generation? Like, how does it?
That's a very good question, actually.
It's like I think most of them are to themselves more often, and most of the communication happens through the digital
Devices.
platforms, And like I said, I see when they're walking on the road also they will be wearing headphones.
Yep.
So
And we can hear the music.
If we
It's that
compare
loud.
ourselves, දැන් අපි ඉස්සර ෆෝන් එකක් පාවිච්චි කරන්න ගත්ත කාලේ then even like kids in 3-4 years old, they use the phone.
They use the
so
phone,
they use the music.
The
everything,
thing is,
they
they're
are
so
exposed.
engrossed, they
Yeah.
don't know how loud it
Loud,
is.
exactly.
it is loud.
Especially when they go to noisy places, they keep increasing the volume, and even the people around them can hear it, and that's very harmful.
So you're playing a concert for the others.
Yes.
Yeah, exactly. And they go to these concerts and everything, and entertainment is nowadays.
It's a huge
Yeah,
factor.
entertainment is good, but you need to think of like what are you exposing yourself into, like ගොඩාක් noises. මම හිතන්නේ ඒ awareness එක නැහැ. අපි industry පැත්තට ගියාම, so we do a lot of industry screening as well. So we know how many people get affected because of the noise and all. But then අපි මියුසික් අහද්දී ගේම්ස් ප්ලේ කරද්දී අපි ඔය awareness එකේ කවුරුත් නැහැ. අපි ලොකු noises වලට මෙච්චර වෙලාවක් expose වුණොත් එහෙම අපිට damage එකක් වෙන්න පුළුවන් කියලා. ඒක ඕනම කෙනෙක්ට වෙන්න පුළුවන්, but no one cares.
Occupational hazard කිව්වම construction sites වල හරි in
Working with machines,
factories,
factories.
they kind of know
No,
They
to
don't
a
act.
not that well.
they know, but even if they are given the equipment to wear, like ear protective devices, we hardly see
see
them
them
using
using it.
any of it. and by the time they retire, they are left with a significant hearing
Hearing.
problem.
Yeah.
And music, they don't even consider it as a, like, it's not an occupation.
Yes.
But like nowadays, like the musicians kind of, they are a bit aware of it, and I see them,
Yes.
you
I think that
know,
because they should protect their hearing and
Yeah.
voice just to, I mean, like,
Yeah,
it's
music
their
for their
pro-
profession
right, profession
and-
now,
Profession.
yeah.
There is a bit of awareness on that
among,
side.
yes.
But
I think if people are
youngsters-
listening, like someone is now also using headphones louder. If you're using headphones that louder, you should take a break. Like if you're exposed to noises, maybe hours noise, you just take a break. Like in
Yes.
15 minutes, take a break, give a break to ear, and then you can start again. I think that's a good practice to do if you're exposed to noise
Yeah.
that much.
And I think all of the mobile devices do have a warning when
Exactly.
you increase it beyond a certain
Certain,
level.
yeah.
So heed that warning.
Yeah.
Don't
Just
take it as
don't ignore it.
Don't ignore
Yeah.
it. So those are the things that they could do.
And also, what do you think about, like, when do people actually should get their hearing checked?
I mean, from the time that you're born, you need to have your hearing screened.
Yeah.
Right? And then school screenings happen, not in all the schools, but annually, I think certain schools, especially international schools and all, they do screen all of their kids' hearing. Then after that, if you get your ears screened maybe every 3 years or 3 to 5 years, that's very good. After you hit 60, you need to do it annually. Like every single year, you do need to get your hearing checked, and that is what is usually recommended. Unfortunately, it doesn't happen in Sri Lanka. We have a very long way to go to.
Yes,
hit
and
that
especially
level.
since this is a social media platform, like every like expecting mother should know that they should get their newborns
Yeah.
hearing checked. Private hospitals, they offer hearing tests
And I think
nowadays.
certain government hospitals also
Certain
recommend,
government
yeah.
hospitals
Yes.
also, yes. But අර දැන් access නැති අය වුණත් දැනගන්න ඕනේ අනිවාර්යෙන් අපි ලංකාවේ නැති වුණාට ලෝකේ තියෙනවා universal hearing screening. ඒ කියන්නේ ඉපදෙන හැම බබෙක්ම screen කරලා තමයි hospital එකෙන් discharge කරන්නේ. So you have to get your newborn checked.
Yes.
So that is a must.
You can check your newborn's hearing quite accurately even after like a day of being born.
Yes.
So that is the most important thing.
Yes. And let's wrap this up. So what is what do you want to tell the general public? Like if you wrap this up in one sentence.
Just pay attention to your ears, though we only have 5 senses, and it's with these 5 senses that we experience the world. And if you even have a little bit of a deficiency in one of those senses, your quality of life will inherently be affected. So just pay attention, because it's not about whether it's a part of aging or whatever it is. Preserving as much as you can towards the end of your life so that you can be happy and the people around can be happy is, I guess, what I really want to say.
So as Chaitra said, like the 5 senses, how do you enjoy your life? අපි කොහොමද ජීවිතේ ෆන් එකේ ඉන්න, like අපිට මේ ඇහෙන්න ඕනේ, පේන්න ඕනේ, all the 5 senses we use for our like සතුටෙන් ඉන්න. So අපිට මේ දේවල් ඇහුන්නේ නැත්නම් කොහොමද simply මේ conversation එක, music, so we need all these to the last moment of our life. So pay attention, අපේ hearing check කරගන්න, hearing ගැන attention එකක් දෙන්න. මෙච්චර කාලයක් හිතුවේ නැත්නම් අද ඉඳන් හිතන්න පටන් ගන්න. ඕන වෙලාවක ගිහලා hearing check up එකක් මම හිතන්නේ ඕන තරකින් කරගන්න පුළුවන්, vision care එකකින් කරගන්න පුළුවන්. අවිලා test එකක් කරගන්න, test එකක් කරගත්තයි කියලා කිසිම හානියක් වෙන්නේ නැහැ. One of the simplest tests that we do on our health.
Yeah.
It takes about 10 minutes to 15 minutes to do it. Doesn't hurt you. You
Yes.
just put on a pair of headphones and say whether you've heard a sound or not.
Yeah.
And Vision Care does free hearing screenings. If you walk into any branch, you can get it done as well. So you don't have anything to lose. Like I said, it's just a matter of investing a little bit of your time.
Time, yes.
Time and be concerned.
Yes.
Thank you so much. Thank you so much, Shatira, Yaset, for joining today with us. And I hope that it was an informative session. And let's meet again. Until next time. Bye-bye.
Bye-bye.
Bye.